Hi, my name's Melissa, and today I'm going to be presenting on malnutrition and its effects on muscle loss. So our body is composed of a lot of muscle. There's actually 700 different muscles that make up our body, and those muscles comprise about 40% of our body weight. Muscles have a bunch of different functions, including movement and balance. So skeletal muscles actively pull on our bones, and that's what causes the movements at joints. They also provide support and balance to stabilize us in situations where balance is necessary. And skeletal muscle is where most of the body's protein is stored. So these proteins can become mobilized when the body faces an illness. So immune cells function properly. So they do have a really important role in immune response within the body. They also help with the healing of wounds. And this can be found in the body's source of the protein IL-6, which has inflammatory properties. So when tissue damage occurs, these proteins are activated to help heal wounds. And then physical strength is probably one of the best known functions of muscles in our body. It just gives us the overall physical strength that we need to do activities for our daily life. It's best to think of muscles as a battle reserve force for when energy is needed to maintain homeostasis. And just in general, muscles in our body just help maintain the overall health that we have. Without muscles, we wouldn't be able to do a lot of the different functions that we are able to do in a normal daily basis. So before we go any deeper into the presentation, I wanted to give a quick background on what lean body mass is and how it relates to weight and BMI, which is what is typically referred to when you have a doctor's appointment. So there is a big difference between these two values. When you go to the doctor, they usually take your height and weight, and this is not indicative of your lean body mass index. So two people can essentially weigh the same, yet one person has significantly more muscle than the other. Lean body mass is the calculation of your body's weight other than their body's fat weight. So lean body mass can be calculated by taking the total body weight and subtracting the body fat weight. And oftentimes the body weight and lean body mass are not proportionate to each other, so it's important to make that distinction between BMI and LBM, lean body mass. Healthcare professionals need to be extremely careful about this distinguishing factor, because two patients can have very different lean body mass indexes, and that could be an indicator of malnutrition. So it's really important for them to make that distinction and also relay that distinction to patients to help them. So feeding our muscles. We all know that adequate nutrition in all areas of macronutrients and micronutrients are important for the body's overall health. But if we're going to think about our muscles in particular, nutrition is a key component, and protein is probably the most emphasized for muscle mass because the nutrients that the body gains from the breakdown of protein is stored in our muscle fibers to help grow them and repair them as they're broken down. So protein is that main source of nutrients that builds and maintains muscle mass within the body. These are broken down into amino acids, which are used and stored in the muscle fibers. There's also some research being done on how vitamins and minerals have been shown to increase anabolic processes or the building of muscles. So some of these vitamins are vitamin D, calcium, potassium. And this has included a relatively new way of incorporating more protein and essential nutrients into the body. So people have started taking oral supplements to provide more energy and protein than many food-based snacks that can be alternately used. This being said, it is still important to make sure that protein is a key component of each meal and snack that people have. Supplements are more of a additional factor that can be added to just make sure you get that proper protein intake throughout the day. And in terms of feeding our muscles, we can also think about other ways other than food and nutrients feeding our muscles. Exercise can also aid in muscle growth and maintenance. In particular, resistance training has been shown to act against muscle loss. And that resistance training is emphasized because it strengthens the muscles as they're being rebuilt. So that resistance and power breaks down the muscles, but then the nutrition can help build the muscles back up in a stronger form. So by incorporating nutrition and exercise adequately into your lifestyle, you can help build more lean body mass. So now getting into more of the main component of this presentation is malnutrition. So the World Health Organization defines malnutrition as the cellular imbalance between supply of nutrients and energy and the body's demand for them to ensure growth, maintenance, and specific functions. So basically, malnutrition can occur with an imbalance of nutrients in the body. This can split into two things. There can be overnutrition, which is too many or excess specific nutrients or calories, or undernutrition, which is inadequate nutrients or calories. Today, we're going to primarily focus on undernutrition and how that affects muscle loss in the body. Okay, so we all know that carbohydrates give us the quick energy source of glucose. And glucose is our primary energy component in cellular processes that help us get the energy that we need for daily life processes. And when we have excess glucose in our body, it's converted to glycogen and then stored in the liver. When malnutrition occurs, there's lower levels of nutrients, including carbohydrates, that provide us with these glucose molecules. So the body has to find alternate methods to get the energy that it needs to carry out cellular processes. So the first thing that's going to occur is called glycogenolysis, and this is where the liver releases stored glycogen as glucose. So those storages that are built up are then broken down to get the nutrients and energy that we need. The only issue with this is that glycogen stores are limited within the body, and they're typically depleted after about 12 to 18 hours of fasting. So overnight, typically your glycogen stores are already depleted, so you have to start that next day with some more carbohydrate high meals to replenish those glucose molecules and the glycogen stores. So when your glycogen stores are depleted, the next thing that happens is lipolysis, and this is when triglycerides in the fat storages of our body are broken down to be used in the Krebs cycle. So the fats are used as an energy source, and they're broken down into fatty acids and glycerol, and then these two components can then be oxidized into acetyl coenzyme A, which can be used in the Krebs cycle for cellular energy. And the final process, when all of these energy stores are used, protein in the body can then be broken down into amino acids, and this is gluconeogenesis. And these amino acids that are broken down are then synthesized by the liver into glucose molecules. Now, this is when gluconeogenesis occurs. Skeletal muscle is the primary storage site of proteins, so the breakdown or catabolism of protein in the body directly impacts muscles in particular. And this is going to lead to the decreased muscle mass that's prominently noted in those experiencing malnutrition. There are a lot of different factors that can lead to malnutrition in individuals. These are psychosocial factors, physiological factors, and pathological factors. And all of these inevitably lead to an inadequate dietary intake and the failure to meet energy and protein requirements for certain individuals. So some of these factors are age influence. So children who are neglected or abused might not be able to get the proper nutrition that they need. Also, on the other end of the spectrum, older adults may unintentionally not meet their nutritional requirements, either because they don't understand that they still need the same nutritional requirements, or they forget to take certain supplements or have different meals. There's also health conditions that can lead to malnutrition, such as injury and immobilization, which causes people to consume less, either intentionally or unintentionally. Mental illness can play a role, such as depression or schizophrenia, because individuals may forget to eat or have no desire to eat. Medicines. Certain medicines can also cause side effects, such as vomiting and nausea, and this can cause people to lose their appetite and then therefore not get the adequate nutrients that they need on a daily basis. Social factors has become an increasingly common factor in malnutrition, especially in adolescence, as peer pressure and media pressures have become more popular. Adolescents have fallen victim to that society's pressure to fall into a certain category. Physical factors are another important thing. So somebody may not be close to a local store and have access to healthy foods. So this is really going to impact their ability to get the nutrients that they need in an adequate amount and a healthy amount. And then even certain physical disabilities, such as somebody having dentures, might cause eating discomfort, which can then lead to malnutrition. So this slide just lists some short-term effects of malnutrition that an individual or healthcare provider might notice via just feelings or physical notifications or indications, along with different lab tests can indicate certain things of malnutrition. So we have some anabolic resistance, there's reduced blood flow, insulin resistance. There's decreased physical functions, which may become apparent to the individual first. So short-term effects could include the individual noticing early fatigue during certain activities or decreased overall strength or power, especially if they're an athlete. Within sports, they may notice a difference in the weight room or even in performance tasks. There can also be muscle wasting, which is another physical sign. The individual might notice this, or a healthcare provider might notice this, and this is where the skin becomes super thin and the individual muscle fibers become visibly apparent, especially in the abdomen or deltoid regions of the body. So these short-term effects can be an early indicator or sign of malnutrition. It's unfortunate that most people don't realize these short-term effects, and it usually comes to those long-term effects where people start to begin to notice malnutrition, and at that point it may have gone too far, which is really the dangerous part about malnutrition. And as I just stated, these are some of the long-term effects that can be seen. So there's that muscle wasting or muscular atrophy, which is the loss of skeletal muscle in the body. There can also be metabolic disorders or disabilities that occur, and then illness and infection is a particularly interesting one and really dangerous one, actually. So with less protein storage in the body, immune function actually becomes compromised, and illnesses and infections start to become more prevalent within the body. There's also an issue that links illness and infection to mortality within individuals. So there's a graph here that shows the direct correlation that's been found between the percentage of lean muscle mass that is lost due to malnutrition and the percentage of mortality risk in that individual. And as you can see, just a 30% decrease in a lean body mass of the individual increases their risk for mortality by 50%. So this is really something that's kind of a new find, and it's particularly kind of really dangerous for the individual. So we want to make sure that we're spotting these short-term effects before they start to become long-term effects. So identifying malnutrition in individuals is really important, and it's something that really needs to be focused on by healthcare providers. Typical physical assessments include BMIs, and it's now known that the BMI of an individual doesn't distinguish between fat, muscle, and bone mass. So we have to learn to start to incorporate that lean body mass index into exams and physical assessments. And the American Society for Parenteral and Enteral Nutrition, or ASPEN, has defined 6 characteristics for the diagnosis of malnutrition within individuals, and these include reduced energy intake, weight loss, muscle mass loss, body fat loss, fluid accumulation, and decreased hand grip strength. It's important for the development of these nutrition-focused physical assessments, and that they now have started to include the physical examination, lab tests, nutrition history, such as food logs and food diaries, medical history, medication reviews, and all of these need to be validated as nutrition-related findings. And this can make it hard for healthcare workers to make a diagnosis because malnutrition can have really varying effects on different individuals. But these 6 characteristics are kind of like the basis or the baseline for a diagnosis. Again, it's going to be different within certain individuals because malnutrition can vary a lot within each individual, but just having these 6 general characteristics can really help move us forward in the diagnosis process. And now we have a quick little case study that was highlighted in a peer-reviewed research article that we're going to take a look at. So this is showing the correlation between malnutrition and the length of hospital stay within individuals. So 30 to 50% of hospitalized patients show signs of malnutrition, and severe nutritional depletion was linked to hospital stays longer than 12 days. And this is important for us to realize because it shows that those who are malnourished are the people that are primarily ending up in the hospital with either illnesses, infections, or malnutrition diagnoses in general. And when we see that severe nutritional depletion is linked to longer hospital stays, that's even more shocking and alarming to realize. So low fat-free mass in 37% of patients hospitalized 1 to 2 days, but low fat-free mass in 55% of patients hospitalized for more than 12 days. So this is showing that greater muscle mass loss or a lower lean body mass is linked or correlated to longer hospital stays for those individuals. Prevention. So how can we start to prevent malnutrition and increase overall health? So maintaining overall health and eliminating malnutrition is essential to maintaining the general overall health of our communities, population, and just individuals in general. So there's a few things that we can do, such as increase the access to nutritious foods for individuals, and we can follow adequate diet outlines and nutritional standards that are set by organizations such as the Dietary Guidelines for Americans, My Plate, the Healthy People Initiative. All of these set certain standards for protein intake and just macronutrient intakes, and they're also a great guide for people to see what they should be consuming to maintain that optimal health. And increased awareness and early diagnosis is always going to be essential for malnutrition. So there's new screening guidelines and biochemical analysis that we can do to help identify malnutrition before it gets to that dangerous too far point. Healthcare providers are going to play a huge role in the diagnosis of malnutrition in hopes of preventing the negative aspects on muscle loss. And protein supplementation that we mentioned before is kind of a newer idea, but it's actually recommended by a lot of different healthcare providers if somebody can't get in that adequate amount of protein or other nutrients. Supplementation can be a really helpful way to meet those nutritional needs. Also, adequate physical activity levels. Just staying active, using some resistance training, all of this can help maintain that muscle mass. And overall, just increased awareness of the effects of malnutrition on muscle mass can likely lead to a better educated community of healthy individuals. Okay, so that is the end of my presentation for the Malnutrition Awareness Fair. I hope you were able to get some important takeaways in terms of how malnutrition can have a direct impact on muscle mass, and I hope that everyone enjoys and really learns a lot from the rest of the presentations this week. Thank you.